What comes to mind when you hear the words heart attack, congestive heart failure, aortic dissection, atherosclerosis, strokes, kidney disease, uncontrolled diabetes? You think about like vision problems, right? I want you to think henceforth hypertension. Hypertension causes all those. And it is often referred to as the silent killer because most people are hypertensive and don't know it. There's really no way of telling that you're hypertensive unless you go to a primary care doctor and they check your blood pressure and hey, it's hypertension, right? It is usually asymptomatic means there's no symptoms. It doesn't come on like, oh, my arm hurts, my head hurts, I have a headache, all the other symptoms that would have with other diseases, joint aches that are very overt. With hypertension, there are no warning signs, right? Some people, for the first time they're diagnosed with hypertension, their blood pressure readings are like 160 systolic over 120, right? Some people walk around hypertensive and don't know it until, like, God forbid, they have a stroke, right? Or they have a heart attack. The message I'm trying to pass is that when we get to a certain age, especially being Black, African American, we are predisposed to being hypertensive. Hey, it's the gift, right? I want it to be a priority, like prioritize your health. After the age of 30, 35, make sure that at least once a year you go see a primary care doctor, get your numbers run, check your blood pressure, the basic vital signs, do a whole like a CMP where they check your kidney function, check your electrolytes. Just know what you're working with, pretty much. Like, know what you're working with. Make sure that you have someone that's on top of it in terms like a primary care provider. Make sure that you report subtle signs and symptoms that result from you being hypertensive. There's usually, like I said, little to no ways of telling that you're hypertensive until something major for some people happens. What causes hypertension, you'd ask? Being overweight, being obese, carrying your weight around your stomach, the abdominal pad, and obesity, being a smoker, not really being physically active, eating not so healthy diet, like less of the fruits and vegetables, eating a lot of meats, diets that are high in cholesterol kind of predispose us to being diabetic. In some cases, certain diseases puts us at risk for hypertension, like the lupus, kidney disease, chronic kidney disease, uncontrolled diabetes would put people at risk for hypertension. Some for the women, being on birth control puts people at risk for hypertension. Some pills and how to call them NSAIDs, like the non-steroidal anti-inflammatories. And let's see, just some factors are like man-made. Like they say, humans are like 80% what we eat and 20% from our parents. It's a provider of respect that said that. I just want us to be careful and more mindful of our health, invest in your health. Like I said in the flu video, make sure that alongside the pulse oximeter, you have a thermometer and you have a blood pressure cuff to monitor your blood pressure at home once a week, once a month, sporadically, just to see where we are. It's better to be safe than sorry. It's better to have a baseline than to be taken by surprise. If you do end up being hypertensive, make sure that you engage in, like, follow whatever your primary care provider tells you to do. They call, like, engage in therapeutic lifestyle changes. Working out at least 40 minutes a day, 3 times a week is helpful, is healthy. Eating better, less of the fatty foods. Also, no smoking, limit the consumption of alcohol, and also do not take medications that are not prescribed to you. There's certain over-the-counter medicines that are not really advisable for hypertensive patients to take if you're not a known hypertensive patient and your blood pressure is elevated and you don't know it, and then you go and take, like, say, a cough syrup like the phenylphedrine over the counter, and you're already running at 160 systolic or 115 diastolic and not know it, that puts you at risk, like major risk for a complication. So make sure to not take medications that are not yours. And if you have a family member, relative, first degree relative, mom, dad, brother, grandfather that had, or grandparents that had major, like, cardiovascular disease, had diabetes, had hypertension, had a stroke, died of a stroke, died of a heart attack, then that predisposes you to being I don't want to say a victim, but you can potentially be in that same light, right? So make sure that you have a primary care provider that oversees your health. You don't necessarily, it's advisable to be insured. You don't necessarily have to be insured. There's some practices that would take out of pocket pay, to where you go, you see a primary care provider once a year, and they do like a complete workup on you. It's, like I said, it's better to be safe than sorry, right? Those are my 2 cents. Thank you.